and welcome to training on how to respond to an opioid overdose. During this presentation, we will discuss the following: defining an opioid, naloxone, and opioid overdose, how to identify an overdose, how to respond to an overdose, Good Samaritan laws, and how to obtain naloxone. During this presentation, we will use the words naloxone and Narcan interchangeably. What is an opioid? An opioid is any drug that contains opium or its derivative. These drugs can be natural or synthetic. The words opiate and opioid can be used interchangeably, although some people make the distinction of an opiate being any drug derived from opium and the poppy plant, while an opioid is used to describe synthetic versions of these drugs. An opioid can be a legal prescription medication such as oxycodone, morphine, codeine, and methadone. Examples of illegal opioids are heroin and, more recently, certain types of fentanyl. Opioids can come in pill form, powder, or liquid. They can be swallowed, smoked, snorted, injected, or drunk. What is naloxone? Naloxone, also known by the name brand Narcan, is a drug that reverses an opioid overdose. Naloxone is a full opioid antagonist. This means it binds to opioid receptors in the brain and blocks the effects of other opioids. There is no potential for misuse, and you cannot get high by using it. And it has no effect on someone who has not taken opioids. Naloxone is safe for pregnant women and children. It can be used as an intramuscular, intranasal, or intravenous medication. The effects wear off in 30 to 90 minutes. Naloxone is only effective at reversing opioid overdoses. What is an opioid overdose? An opioid overdose happens when a toxic amount of an opioid, alone or mixed with other drugs, overwhelms the body's ability to handle it, and you stop breathing. After 4 to 6 minutes of not breathing, your heart stops and you die. Mixing opioids and other drugs greatly increases the risk of an overdose. Many opioid-related overdoses result from mixing prescription painkillers or heroin with cocaine, alcohol, methamphetamines, and/or benzodiazepines, also known as benzos. How to recognize the signs and symptoms of an overdose. The signs of an opioid overdose include loud snoring or gurgling noises, a person's body being very limp and unresponsive, their skin being pale gray and clammy, someone's lips and fingertips turning blue, having a slow or erratic pulse, breathing very slow, shallow, or not at all, and of course, being unconscious. How to respond to an opioid overdose. To respond to a suspected opioid overdose, first try to rouse and stimulate the person. To do this, shake the person to see if they respond. If there's no response, make a fist and rub your knuckles firmly on the person's sternum to see if they wake up or respond. If there is no response, try to place the person on their back. Administer your first dose of naloxone, either by an intramuscular injection or using an intranasal kit known as Narcan. Please remember that it will often take multiple doses of naloxone to reverse an opioid overdose. These are the various types of naloxone. This is a vial of liquid naloxone. This is the nasal spray known as Narcan. This is the Amphastar nasal spray kit. And this is the auto-injector known as Fzio. Each intramuscular kit will come with multiple 0.4 milligram vials of naloxone and at least one new syringe. Follow the rouse and stimulate steps to determine if this is an opioid overdose. Try to place the person on their back. If you cannot put the person on their back, administer their first dose of naloxone anyway. Pop the top of a vial insert a new needle into the vial and draw up 1 cc of naloxone. If an alcohol pad is available, Clean the skin around the injection site. Inject naloxone into the person's shoulder, thigh, or buttocks. It's not a Hollywood movie, so do not inject the person in their heart, chest, or on their back. This is meant to go into a muscle, not a vein. This needle can go through clothing. If multiple syringes are available and multiple doses are needed, use a new syringe for each dose of naloxone. Call 911 immediately after giving the first dose of naloxone. This is the Fzio auto-injector. Each kit will come with 2 doses and a trainer to practice with. The auto-injector works the same as the intramuscular, except everything is already contained in the kit. Follow the rouse and stimulate steps to determine if this is an opioid overdose. Try to place the person on their back. Same as before, you can inject someone in their shoulder, thigh, or buttocks. To inject, remove the kit from the plastic case.
This trainer contains no needle or drug.
Remove the red tab and inject the person in a large muscle for 5 seconds as the device counts down.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
If you're deaf or hard of hearing, count for 5 seconds while giving the injection, then remove the device. Call 911 immediately after giving the first dose of naloxone. Narcan is simply the brand name for this device. Naloxone is the active medication inside the device. To use Narcan nasal spray, follow the rouse and stimulate steps to determine if this is an opioid overdose. Try to place the person on their back. Peel back the tab with the circle to open the Narcan. Hold the Narcan with 2 fingers and your thumb on the bottom plunger. Tilt the person's head back while placing a hand under the back of their neck. Gently insert the Narcan into the person's nostril. Firmly press the plunger and spray the medication into the person's nose. Remove the Narcan from the person's nose after administering. Call 911 immediately after giving the first dose of Narcan. This is the Amphastar nasal naloxone. To use this kit, follow the rouse and stimulate steps to determine if this is an opioid overdose. Try to put the person on their back. Remove caps from the needleless syringe and screw in the nasal atomizer on top of the syringe. Remove cap from the pre-filled vial of naloxone. Gently twist the naloxone into the vial delivery system until you feel it catch. Tilt the person's head back so the naloxone doesn't run out of their nose. Gently place the atomizer in the person's nose and inject half the naloxone into each nostril. Call 911 immediately after giving your first dose of naloxone. Describe the situation and request an ambulance. If someone else is with you, have that person dial 911 as soon as you think someone is experiencing an overdose. If you're deaf or hard of hearing, use the text feature to notify 911. If the text feature is unavailable, use a TTY or a telecommunications relay service if possible. Use your best judgment on whether to call 911 before administering naloxone. But keep in mind that every second counts when someone is not breathing. The faster you administer naloxone, the better the chance someone has at surviving an overdose. Calling 911 is very important regardless of whether it's before or after administering naloxone. The person might not be experiencing an overdose. It may be a heart attack stroke, or other medical emergency. The person might have other health conditions. Often, you may need additional doses of naloxone to reverse the overdose. Most importantly, the effects of naloxone are temporary and may wear off, causing the person to overdose again. So being seen by medical professionals is very important after an overdose. After administering the first dose of naloxone and 911 has been notified, begin rescue breathing if you feel comfortable. To rescue breathe for someone, lay the person on their back. Imagine the CPR position. Make sure the person's airway is clear. If you have a plastic face mask, place it over the person's mouth who is unconscious. Tilt the person's head back, pinch both nostrils, and breathe one quick breath every 5 seconds for 1 minute. Remember to breathe easy into the person. Try making the H sound instead of the W sound. Woo. You're not trying to blow up a balloon, but simply exchanging your breath for theirs. After 1 minute of rescue breathing, stop, listen, and feel. If the person has not started breathing, administer the second dose of naloxone and begin rescue breathing again. Repeat for 1 minute, look, listen, feel. After administering 2 doses of naloxone, if the person has not started breathing on their own, continue rescue breathing and administer any additional doses of naloxone every 2 to 3 minutes until the person starts breathing or first responders arrive. If you do not feel comfortable rescue breathing, wait 2 to 3 minutes after giving the first dose of naloxone. If the person has not started breathing again on their own, administer the second dose of naloxone. After the second dose, if the person has not started breathing on their own, continue to administer any additional doses every 2 to 3 minutes until first responders arrive. If the person starts breathing again and regains consciousness, place them in the recovery position by putting them on their side, with one leg over top of the other and one of their hands under their head. This is to allow any fluid in their lungs to drain and avoid choking. Stay with the person until medical help arrives. The person may feel sick, agitated, or even vomit. If they are unable to sit up, or if you have to leave for any period of time, put the person in the recovery position. Try to keep the person calm and encourage them not to take more opioids. If the overdose does reoccur, give another dose of naloxone. Many people that overdose are left to die by others who are afraid of going to jail for possession of narcotics or paraphernalia. Good Samaritan laws protect individuals who call 911 in the event of an overdose. Under Maryland's Good Samaritan law, if someone calls 911 in an effort to help during an overdose crisis, or they are experiencing an overdose, their parole and probation status will not be affected, and they will not be arrested, charged, or prosecuted for possession of a controlled dangerous substance, possession or use of drug paraphernalia, or providing alcohol to minors. The Good Samaritan law does not apply to drug felonies or other crimes not listed. Additionally, it does not prevent law enforcement from conducting an investigation and gathering evidence. If your state does not have a Good Samaritan law, or you fear being arrested, please at least give a dose of naloxone and call 911 before leaving the scene. How to obtain naloxone. Any individual may receive a prescription for naloxone from a licensed healthcare provider with prescribing authority. You can obtain naloxone from an authorized overdose prevention program or entity that dispenses naloxone. Anyone in Maryland who is unable to access naloxone through the pharmacy or other sources can have it mailed to them as well. To make your request, visit this website, nextdistro.org/Maryland. Any individual can obtain naloxone at a participating pharmacy through the statewide standing order. As of June 1st, 2017, there is no training or certificate requirement in Maryland to obtain naloxone from a pharmacy under the statewide standing order. bha.dhmh.maryland.gov/naloxone. Once you have a naloxone kit, try to keep it in a cool, dark place and avoid direct sunlight or hot spaces, as well as freezing temperatures. How not to respond to an opioid overdose. Do not use ice to cool someone down or put the person in the bath or shower. Do not hit, slap, or burn the person. Don't give them a drink or try to induce vomiting. Do not inject salt water, milk, or cocaine into the person. In the past, some of these remedies may have worked, but they worked on heroin 20 years ago, not the new fentanyl analogs that are so prevalent in 2020. These actions can also cause further health complications. How to avoid an opioid overdose. Never use alone. Try to avoid mixing other drugs with opioids, especially cocaine, alcohol, or benzodiazepines, also known as benzos. Ask your local harm reduction organization about ways to test your drugs for contaminants. If you have not used opioids in a while, your tolerance to these drugs will be lower and risk of overdose much greater. So use less opioids than you normally would. Create an overdose prevention plan by using slowly or in a less risky way, such as smoking instead of injecting. Make an overdose response plan and share it with someone who you trust to give you naloxone if needed. Never be afraid to reach out for help. If you don't know where to find help, search Maryland Harm Reduction to find an organization in your area. Be safe out there. Carry naloxone and save a life. It could be your own.